Hello, everyone, and welcome to When Docs Talk. Hey, Davita.
Hi.
Hey, Sonia. We can't hear you, honey.
I might help if I unmute. Sorry. Hello, how are you?
There we go. There we go. So, welcome everyone to When Docs Talk. For those of you who are joining us for the first time, we give you a special welcome. We want to tell you a little bit about who we are and what we do. We're so thankful that you're here with us today. So first things first, my name is Dr. Dion Metzger. I'm here in Atlanta. I'm an emergency physician, and I hail from Miami, Florida, but I hail by way of Nigerian parents. I've kind of lived in every corner of this United States, and so I'm really happy to be here with you. This project, When Docs Talk, is a collaboration of emergency practitioners. Basically, we want to give you a perspective that you don't often see. You hear about pop culture, health, politics in the news, but you don't often hear it from people like us who have seen the kind of things that we've seen. So we're really excited about this project, and we're really excited to have all of you joining us with this project. We've had thousands of views on Facebook, YouTube, and we appreciate all of our viewers. I appreciate your questions. I appreciate your support. We're listening to you, the things that you want to see. We're going to try and accommodate you. I want to tell you about some changes before we jump into this show. So this is the first time that we are streaming almost exclusively from our YouTube channel. Our YouTube channel is the place where you can watch all of our old shows and certainly catch us live anytime we come live. You can also watch live at WDT's Facebook page. So we do have a Facebook page, When Docs Talk. You can join us live there, post any of your questions, and we'll try and answer them and pose them to our guest experts. So what are we talking about today? Let's talk a little bit about that. We have all collectively agreed here at When Docs Talk, and just talking to our families and friends, that this year has been particularly challenging for a lot of us. We believe in health in its entirety, mental, physical, emotional, spiritual, all of it. And we always had planned to have an episode on mental health in America. But 2020 has amped up that need to do so. We have heard stories of anxiety, depression, fear, uncertainty. We've also heard stories of resilience. Some people are like, listen, we're just going to keep on pushing. But we recognize that it's an important discussion to have. We wanted to take the pulse, because we're emergency practitioners. We want to check the pulse on our mental health, on your mental health. And so we've started this series entitled, Are We Okay? Are You Okay? And what we'll be doing is, even though this is the debut, it's going to be a symposium today, long episode, lots of things packed. We want you to know that we're going to be having bits and pieces throughout the months of October and November in our Are We Okay series. So you'll be hearing from our different experts. If you don't catch the whole thing today, you'll definitely see it. We'll post it on our YouTube channel, on our Facebook channel. You'll get to hear the full interviews with some of our guests because they have a lot of wonderful things to say, but we can't put all of it in today. So we just want you to know that this is just the start, just the debut. So look for our Are We Okay series. We're bringing it to you. Post your questions, be involved in this discussion, and let's get started. I want to bring back my co-hosts who have been listening to me talk. Let's bring them on so you can see them real well. Let's introduce ourselves to our audience for those who don't know you yet.
Okay, so I'm Sonia Penson. I'm a family practitioner trained, but I work in an ER setting. I was born and raised in Georgia, and I'm also a Navy veteran. Was in the Navy for 9 years, decided to come back to Georgia as well as come back to Atlanta, kind of where I'm from. So glad to be here, glad to be a part of this show, and looking forward to hearing our great guest this evening.
Hi, everybody. My name is David Yipe. I am an ER nurse. I've been a nurse for 5 years now. That's why I met Dr. Yipe. I am originally from Memphis, Tennessee, but I've been in Atlanta for about 10 years now. So at this point, I am a Georgian.
Yes.
I'm excited about what we have in store for tonight, and hopefully everybody will enjoy it as much as I did.
Let's hope so. So I want you to know we have a bigger crew than this. We have a couple of members who will be joining us later today, and some who are working couldn't make it. We're all frontline workers, so we got to stay on that front line. Morgan and Yolanda hopefully will be able to join us later on in the show to give us their perspectives on what's going on from a mental health perspective in their lives and just in what they're seeing in their patients' lives. Okay, so I want to know from you all out there, are we okay? Do you feel okay? Is 2020 treating you all right? But for those of you who have been with us since the beginning, you know how we do. We love the quizzes. And so we're bringing the quizzes back. I want you all to post your answers and let us know what you think to this first question. Davida, you want to ask them?
All right. What percentage of Americans suffer from a diagnosable mental illness in a given year? A, 50%, B, 10%, C, 20%, or D, 5%?
Somebody has the Jeopardy answer on there. We're trying to figure out in a given year, how many Americans, this is just for the United States, have some sort of diagnosable mental illness? Do any of you know? What would you guess?
Before I knew the answer to the
Before
question?
you can't guess.
No, I didn't know.
You know what? We won't even put ourselves on the spot. Let's let our viewers know.
C,
so
20%.
That's right. So approximately 1 in 5 U.S. adults, at least on any given year. Now, things might have changed now, and that's what we kind of want to talk about. Have things really changed in 2020? Is that different? Are there more people who are experiencing problems with mental illness of some sort? And so I wanted to bring on some data from the CDC. So the CDC stated that during late June of this year, 40% of US adults report struggling with mental health or substance abuse. We also throw that in there. And if you look at this over here, you can see that at the top of that are anxiety and depression symptoms. Okay, we also talk about trauma and stressor-related disorder symptoms. There are about 13% of our population that admitted either starting or increasing their level of substance abuse. And then, of course, there's a segment that have seriously considered suicide in June of 2020. And so that begs the question, how are we feeling? Are we okay? How are we doing? Now, some of you out there were part of our survey. We did a survey here at When Docs Talk where we asked our viewers and friends, family, people that we don't know, whomever, to do an anonymous survey about their mental health. And some of the questions that we answered or had you answer, we wanted to share with you because I feel like there's this sense, and you guys can tell me what you think, ladies. I feel like there's this sense that you're kind of alone and that you should kind of suck things up. You're fine. You know, yes, everyone's struggling, but, you know, maybe you're struggling a little bit more than others. Is that the sense that you sometimes get?
Yes, or people just don't feel comfortable letting other people know how deeply some things are resonating because they seem weak, or especially with the Black community, I would definitely say they don't want to feel too vulnerable with some things that they're struggling with.
Absolutely. Well, let's see what our pollsters, our surveyors said.
So has the year 2020 been challenging for you? And so 111 people answered, and it was 102 out of all those people, 91 or 92%. That said yes, that it's been challenging. So that's a real big majority. As well, no, it was only 8% or 9 people. So definitely, it seems like for the most part, the majority of people feel like it's a challenging year.
Yeah, for sure. Now, I agree too. Now the question is, okay, so we asked them if they felt like they're having challenges, but I wanted to know also, are they feeling that this year is more challenging, right? So maybe every year those same people feel like they're challenged. And when we asked them that, have you found this year more challenging than other years? The vast majority of our respondents said yes. I mean, almost 83% were like, yes, this is definitely more challenging than most years. Mm-hmm. We also asked another question.
Are you concerned about the mental health of a loved one? 76% said yes. And this was an interesting question. I really didn't even think about to ask, but just to see the response of people is definitely something that's a concern.
Yeah, absolutely. Mm-hmm. Now, we asked kind of the big question. We're focusing on mental health, and emotional wellness. So we're asking about, are you feeling like it's challenging? Are you feeling like it's hard for loved ones? But the real question I wanted to know is, do you feel like the events of this year have negatively impacted your mental or emotional health? Because sometimes I use emotional as well, because sometimes when people say mental health, they think about some sort of big diagnosis that they have to have. So they don't even recognize that there is a problem. So I wanted to get a little bit of a wider perspective. And you can see there that the vast majority of our surveyed viewers and people who answered the survey believe that this year has negatively impacted their mental or emotional health.
Mm-hmm.
So on that note, recognizing that this year is a challenge to most people, I wanted to start with our first guest, because this doctor talks to us a little bit about what she feels are the challenges of this year and how people are coping. So let's go ahead and bring her on. One thing I want to mention to our viewers is that our first guest is actually from a pre-recorded session. So we'll just see bits and pieces of what she had to share with you. However, please still feel free to post any questions or any comments that you have. And also keep in mind that we will, at a later date, have the full interview. I want to bring on a special guest who can help us a little bit in our discussion on reflecting in mental and emotional health and wellness. I want to put up her picture. So we are so fortunate to be joined by Dr. Dion Metzger, who is a board-certified psychiatrist who manages her own practice in Atlanta, Georgia. Dr. Metzger is currently on faculty as professor of psychiatry at Emory University School of Medicine, as well as the Medical College of Georgia and Morehouse School of Medicine. She's a mental health expert who's been featured on The Doctors, Oprah Winfrey Network, ABC, NBC, HLN, and even in the New York Times. We are so fortunate to be joined by this wonderful expert, this fierce and beautiful lady. I'm gonna bring her on stage to see. Welcome, Dr. Metzger.
I feel so great with that introduction. Thank you very much.
Well, you're good.
Hey, Dr. Metzger.
Hi, Morgan.
You're just great. How are you doing?
I am doing well considering the climate, I should say.
I know.
Yeah.
Well, let's just jump right into it and talk about that climate. Okay. Everyone keeps talking about 2020. I can't wait till it's over. 2020 is the worst year ever. So everyone kind of collectively agrees that 2020 is a big thumbs down, double thumbs down. I want to know from your opinion as a medical and mental health expert, actually, as a psychiatrist, what you feel are the biggest challenges to mental health in 2020 specifically.
The thing with 2020 is just the uncertainty, right? So there's a big play on fear here. So we have like the pandemic where we don't know what can happen and we don't know an end date. So that alone is causing anxiety because we don't know when the lifestyle that we're living now will come to a close and we'll get back to what our normal is. But then we also have, everything else that's going in the world, like right now, like in terms of racial justice and all of that. So I think it's like you were getting hit over the head with multiple things going on all at once. Oh, and it's election year. So, it's just like there's so many things going on. And I think because there's so much uncertainty attached to every single thing, because we don't know who the president's going to be. We don't know, what is going to come of this in terms of our protests and everything. And the pandemic, we don't know when a vaccine's coming. We don't necessarily know when we're going to be able to be outside and comfortable outside. So, I think the uncertainty has been the biggest issue of 2020, where we know we're in a bad time, but we don't know when the bad times are going to stop.
Right.
And that's what makes people really, really anxious.
Absolutely.
There's no light at the end of the tunnel.
Yeah, man. I mean, but sooner or later, we got to get out of the tunnel, don't you think?
That's right.
I was like, when the year started and Kobe died, I was like, oh, this is it for 2020.
Oh, no.
I was like, oh, we're done. We're done.
Do you know what, Dr. Metzger? What I realized is that there is so much that has happened that I think that we are unable to digest it. We almost forget. When you just said Kobe died, I almost forgot that also happened. And that was devastating to me and a lot of people at the time.
And I was like, and my husband and I, we're like, oh yeah, this is the tragedy. This is what 2020 will be remembered for. No. We have more. So yeah, I mean, I think just boom, 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 everything is just like after a while, we're starting to kind of build this callus and this Teflon, like, okay, what else can happen? Because we've lost so many greats just in, I mean, we're only in September. We're not even done with the year. So I think just kind of having everything happen back to back has been really what's had its impact on us.
So let's talk about the more personal hits to us. So even if you didn't know any of the celebrities, even if you haven't personally been affected by the coronavirus, most people know someone who has been affected by the coronavirus. Several of us have actually experienced loss from the coronavirus. And so I want to get your perspective on how this might be affecting us from a mental health perspective. Coronavirus specifically.
It's just really, really difficult. First of all, we've never experienced anything like this. So we have never been in a pandemic. So let's just go ahead and say that off the bat, that this is just something very brand new and it's very scary. We've only seen this in films. Like we've never actually been part of this. And what happened is the anxiety started to creep up. I mean, I think when March 1st hit, we're like, okay, we're going to be inside for a few weeks. We'll get through this, put on a mask.
Right.
But it happened with me where I started noticing that the circle started getting smaller. Like I'd hear of somebody dying from COVID, but now it's like my neighbor's parents, so it got closer and closer. So it was almost like the walls were becoming closer on us and it made us feel more anxious. So it's definitely had a huge impact in terms of, it just not being a problem of the elderly or the immunocompromised. It is now something, even right now, young adults is I think the growing age population. So it's something that has become very, very real. And once again, just like not something we can brush off and we have to move forward. But it has become progressively scarier. And I think that has contributed to a lot of increased anxiety going on during this time.
How can somebody access mental health care in 2020?
Well, one positive thing about this is that now because we flipped to virtual, distance is no longer a barrier. So like I haven't seen a patient in person in 6 months. So everything is virtual. So now like I'm able to see people across the state, all the way down to Savannah, because I'm in Georgia, just in case. I'm in Atlanta, Georgia, but I can see people all across the state. So actually it's more convenient now because we're all mostly virtual and you can make the appointment and you can be able to be seen pretty quickly just because we don't have kind of that issue of distance and we're able to have a little bit more flexibility with our hours. So during this time, it's actually almost easier to get in and see somebody and going from there. But I always say, one thing that I love to recommend is psychologytoday.com, because what happens is you can put in exactly what area you live in. You can say what kind of therapist you want, if you want a psychologist, if you want a psychiatrist, and if you have insurance, they'll filter it based on who accepts your insurance. And then you can also filter it based on what you want to work on. So let's say if it's grief or trauma or relationships or it's for children, you can put that in the filter. So they will tell you exactly what they can give you the providers that are just for those things that you're looking for. So you don't have to sift through so much, because a lot of people are like, listen, I don't know where to even start to find somebody. But that's a really good place to start. And, and if you have a specific, and I always tell people, if you want a therapist who looks like you, there's nothing wrong with that. If you feel like it's all about who you can connect to. And if you don't have a good rapport with your therapist, you're wasting your time. So if you rather have a female, if you rather have somebody younger, if you rather have somebody of the same race, go ahead and choose it. Look at the pictures. Like, it's okay. It's okay. The whole point is we want you to be as comfortable as possible and, try to make the search process as convenient as possible so you can get in and get treated.
Are there any other take-home messages you have for our viewers?
We're going to be okay. I know that is as simple as it sounds, but We're going to lean on each other. We're going to reach out for help when we need it, and we're going to make it through this. And if you have any concerns about anybody that around you that you notice a change in behavior, just reach out in love.
I love
Absolutely.
it. Well, thank you so much, Dr. Metzger.
Thank you. Thanks for including me.
Thank you.
We love having you. We hope to talk to you again in the future, and
Absolutely.
we're gonna take your advice straight
Very
from
Yes,
the
absolutely.
All right. So that was our interview with Dr. Dion Metzger, psychiatrist here in Atlanta, Georgia. And I thought she raised a lot of great points. As I mentioned, it's not the full interview. She had a lot more to say to us. So please stay tuned for our Are We Okay series so you can hear more from that interview. But I want to bring on some of our live guests because we're so excited to have them here. And before I do so, since we talked a lot about coronavirus, Sonia, I thought that it was important for us to just do a little introduction about the virus. It is something that is a huge stressor for many of our viewers and even for us in 2020. So we always have in all of our shows, for those of you who are joining us at When Docs Talk for the first time, a coronavirus moment or update. And what we're going to do instead today, just to lighten the mood a little bit, but also to give some good mask etiquette, is I would like to show a little clip from one of our friends of When Docs Talk, Dr. Anwar Osborne. He was a guest on one of our previous shows, and he has a few words to us and our viewers about mask etiquette. So please enjoy, and we'll bring on our next guest in a few moments.
Hi, I'm Dr. Anwar Osborne. There's been some confusion lately about wearing masks, and I want to give you the facts. Masks are like your drawers. Follow drawers rules. Rule number 1, don't let anything hang out. Nothing should be peeking out of your drawers ever. None of this. None of this. You can't bird box the Rona. Rule number 2, don't adjust in public. Would you really dig deep to pick out a wedgie? No. Don't adjust them in public with your hands. Your hands carry germs. Wash those nasty things before you put your mask on and before you take it off. Rule number 3, keep them off the table. When you go to a restaurant, would you just casually toss your dirty drawers on the table? I don't need your Fruit of the Looms next to my guacamole. No bueno. Rule number 4, wash them or be nasty. If your mask has more stains on it than the Tupperware you use to store your tomato sauce, you got problems. If it has holes in it, trash it. Wash your mask. Rule number 5, don't swap them. Don't share them with your friends. Hey, bro, can I borrow your boxes real quick to just run in that store over there? I mean, for real, remember the rules. Don't let anything hang out. Don't adjust anything in public. Keep them off the table. Wash them or be nasty. And don't swap them. Most importantly, wear them. Now you know. Don't forget it.
So that was Dr. Anwar Osborne talking to us a little bit about coronavirus. But I wanted to talk about two of our guests. I'm going to start with Dr. Jeffrey Rakofsky, who's here with us. We actually went to high school together, so it's really nice to see him in this setting. It's like a mini reunion, and he has a lot of good information to drop on us. Dr. Jeffrey Rakofsky is an adult psychiatrist who specializes in the treatment of mood and anxiety disorders. He is an associate professor at Emory University, where he directs medical student education in the Department of Psychiatry and Behavioral Sciences. We're so fortunate to be joined by Dr. Jeff Rakofsky. How are you doing?
Good. Happy to be here.
Thank you for being here. Sonia, do you want to tell us about our next guest?
And then, yes, I had the privilege of introducing Ms. Ola Ogaga. I had the privilege of working with her while she was still an emergency room nurse. And while she was working as an emergency room nurse, her experiences illuminated the disconnect between medical and psychiatric care, especially how the mind and body connection are ignored. So this kind of encouraged her to pursue her Master's of Science in Nursing from Georgia State University, and she obtained her psychiatric mental health nurse practitioner title. And in doing so, she wanted to develop a practice that integrated medical and mental health for the most effective treatments. So now she's a Georgia board certified psychiatric nurse practitioner. And she currently takes care of people in her private practice, Mindset Healthcare, where clients can receive medication management if warranted and therapy. She possesses the natural ability to build rapport with her clients and their families, and that leads to positive outcomes related to their treatment. Her belief in the mind, body, and spirit connection guides her, educating them and allowing them to view themselves as whole, not parts, which lead to a path towards their healing. So thank you, Ms. Lola, for being here and participating.
Thank you for having me.
All right. Thanks, Lola, for being here. I want to start with you, Dr. Rakofsky. You heard, I believe, a former colleague of yours, Dr. Metzger, talking about what she believes are the challenges in 2020. My specific question to you is the same. I want to know what you think is the most difficult thing as a mental health expert and psychiatrist, and what you're seeing more of in this year, if anything.
Yeah, well, I would agree with Dr. Metzger that one of the biggest challenges of this year is the number of crises that we're facing. Not just one, but several. Right? We've got the pandemic. We've got the economic problems that are coming as a result of the shutdown itself, hyperpolarization like we've never seen in our society, climate change issues, and they're all hitting us at the same time. And so, I think people are feeling a lot of despair, uncertainty, fear, and people are feeling more divided at the same time. So they have less people that they can connect with. A part of that has to do with social media. The other part has to do with, I think, all the isolation that's been brought on by the shutdown, the quarantining as part of the pandemic.
Okay, I see. Yeah, it can feel very isolating, obviously, with the shutdown and so forth. Lola, I have the same question for you. What do you think is going on?
With mental health in
2020, what makes it different? Why is this different? You both work in, practices that are outpatient. Jeff, I know you also see people inpatient, but I'm really trying to get at what is different. What are you seeing differently? So the same question I posed to Jeff, I kind of want to know from you. I see you're at your clinic, and I want to know what's going on in 2020 from your perspective.
So what I'm seeing is an increase of alcohol use, increase of substance abuse use, of course, depression and anxiety, and just the worrying and not knowing what is going to happen tomorrow. Because media plays such a large role in a lot of our decision making. And so for me, I try to tell my clients to stay away from media, especially if it's not a reliable source. And they say, what's the news? It's the news. And I'm like, just because it's the news doesn't necessarily mean that it's real. And, don't focus so much on tomorrow, because fear is horrible and it will encapsulate you and prevent you from doing anything. And by me working outfield, I work for court agencies as well. And I have a lot of schizophrenic patients, and they already have that paranoia. So this is making it worse. Mm-hmm. And so just being able to express to them like, hey, I understand, and I'm not negating the fact that coronavirus is not real. We all know that it's real, but take your necessary precautions, because you still have to live. You still have to go to the store, get groceries. You still got to go get your medicine, So you still have to, you have to eat. So you have to go to the grocery store. You have to do whatever it is to maintain your activities of daily living. So if you run out of tissue paper, you're going to have to compromise. We're going to have to wash more and get a wash rag. Like, try to find an alternative route and don't focus so much on the problem, but find a solution.
Well, let me ask you a question. You kind of brought it up from the standpoint, like there's a lot of people that already had mental illness or mental health issues. So do you find that it's making those issues worse and harder to treat?
Definitely. I had a client right before, she was a young adult. She came in, she was experiencing depression from school, and she had some anxiety. And I started her on medication, and she was doing well. She started coming to me in November. She was doing well. When the pandemic hit and school stopped, it was like, the medicine's not working anymore. I feel bad. There's no prom. I can't graduate. So all those anxiety of, if I can't do all of this, if I can't graduate, then I can't go to college. I can't do this. So she's worrying about the future. It's not even here yet. So now she's, the mind believes what you tell it. So if you tell the mind my medicine's not working, it's not going to work. And no matter what was going on, she had this relief until the pandemic hit, and then things started going downhill. So I increased her medication. We increased her therapy. She's doing better now, but she was scared.
I can imagine.
Everybody was.
Everybody
the media showing all these body bags, everybody dying. You're like, oh my God, am I going to die tomorrow? So.
I hear you. Jeff, I have a question for you.
Sure.
I want to know if you feel that there are certain subsets of our population that are particularly more vulnerable during this time period.
Yeah, well, certainly the elderly that are in nursing homes, who haven't been able to connect with their families for safety purposes. But, a lot of folks in that age group are already dealing with isolation. And so then when we closed down all the nursing homes we put them on isolation, that just made it so much harder. And the problem with isolation is that it's deadly. We know that loneliness is associated with increased risk of mortality and certainly makes depression worse. So they're a particular group that I'm very much worried about. Yeah.
What can people do for loneliness, right? You mentioned that just by nature of what's going on, even let's take just from a COVID standpoint, the shutdowns, and even outside from the shutdowns, as things are being lifted, it's still not the same life that we knew. You still can't just go out to a restaurant in most cases and easily engage with your friends as you did. So the elderly who are in nursing homes, or even younger people who are at home by themselves with not very many places to go, what do you suggest that they do to help with that isolation?
They have to be intentional about finding alternatives. They have to see this as a time to try to rebuild a new normal in the meantime. You hear people talking about the new normal. Well, in order to stay well, these things have to be prioritized, and you have to figure out a way to try to have that social contact in a safe way. So, some people are setting up weekly family Zoom meetings, or, finding a safe friend, a friend who can also commit to being safe during the week, and then hanging out, once a week. And that way they can still be in person and have that connection. Of course, both wearing masks and maintaining distance. But the key is to be intentional, to be safe, and to make sure that it's part of your weekly routine.
Let me ask a question also from the standpoint of, definitely there already prior to this, there was a stigma around mental health, getting help. Do you feel like that with all of the things that are going, is that making people more engaged in coming to or trying to pursue help? Or do you feel like it's still an issue in order for people to come, be open and getting help and seeking help?
Is that for me or for?
Yes, I'm sorry.
Yeah. Stigma is certainly an issue. It's gotten better over the years. There's studies that have looked at reductions in stigma. There tends to be more stigma towards certain aspects of mental illness than others. So there's a lot more stigma towards having bipolar disorder or schizophrenia than there would be towards having depression or anxiety. But there are a lot of people that might not meet criteria for a psychiatric illness that could still benefit from having a therapist to speak with, because maybe they are having just a hard time coping. And I think with all of these commercials for therapists by app or online therapists, I think that's helping. I can't speak to the quality of those programs, but just the fact that they're commercials, and you have celebrities that are talking about it and saying, "Oh, therapy saved my life." I think that helps, and the fact that so many of us we're all in this together. We're all experiencing a lot of these same things. I think that too might help with stigma reduction.
How about, I want to ask that question to you too, Lola, just because I know that there are different, I know in our community, and that is the Black community, there's stigma too. And it's also not a tradition of seeking mental health care. So I'm curious to know if you're seeing problems with getting clientele that are in the Black community.
Always. It's the stigma, but as a mental health provider, it is my job to erase that stigma. And I tell everyone, I relate my analogy is mental health and physical health. We all have physical health and we all have mental health. We have parameters that dictate whether our physical health, when you go take your questionnaire, is it good, poor, or fair? The same thing with your mental health, is it good, poor, or fair? And when the parameters that we use for our physical health is, we'll check our blood sugar, we'll check our blood pressure, and based on those parameters, we'll say, oh, okay, so now you no longer have, because your blood pressure is high or they check your hemoglobin A1C, now you no longer have physical health, you have physical disorder. You now have been diagnosed with diabetes, or you have been diagnosed with high blood pressure. The same thing when it comes to mental health. Like, every day is not going to be a good day, and some days are going to be bad. But so that's still your mental health. But when it turns into weeks and days and months and years, that's when it becomes a disorder. Right. So we all have, and that's the best way that I try to give that analogy. And people like, oh, well, when you put it that way, okay. So it's just trying my best to do my part to erase the stigma that is attached and let everyone know, hey, it's okay to not be okay.
Yeah.
And to reach the help that you need and talk about it. So if we can erase the stigma, then we can have more people who are willing to speak, and we can prevent suicide. We can prevent increased anger, right? Because you're not want to talk to someone, so you take that rage and then you go shoot somebody. So there's a lot of things that we can prevent if we erase that stigma.
Absolutely. I wanted to ask a question that popped up on the stage, which I think is an important one. I'll start with you, Jeff. Because you work in academics, so I just assume that you're privy to all the facts and stats and research. I want to know if suicides are increasing. One of our guests wants to know, and I want to know in general, for actually two reasons. One, because it's an important question, and two, because often you hear the narrative that, well, we shouldn't be too isolated with the coronavirus. We don't have to follow these protocols because even though the virus kills, suicide and depression and substance abuse kills more. And so they're pitting these two ideas against each other and trying to decide which is more dangerous. So my first question is, are suicides on the rise? And my second is, what are your thoughts about the whole comparing the coronavirus and death from that to death and problems from mental health?
Yeah, so in order to answer the question about suicides, we usually look to CDC data, and the last CDC report on suicides reported on data from 2018, which showed that rates have increased. But if we just talk about looking at suicidal ideation, there have been reports that show, I think the graphic that you showed before from the CDC included a question where they asked respondents in a survey in the last 30 days, have you had an increase in suicide or thoughts about death? And there was an increase greater than what had been seen in the months before when they had run that, or when they had performed that survey. And what was interesting was the people who and the groups that were most likely to have those increases in suicidal thinking. And it was people of color, people that were caring for adults but unpaid, so like people caring for their own parents, and also people of Hispanic background as well. So the answer is yes. There's been an increase, certainly an increase in suicidal thoughts. And actually, let me also say in the military there has been documented an increase in suicides. Now, their population is a lot smaller than the population of the whole country, so it's easier to be able to come up with those numbers more readily.
Great. I mean, we figured that was the case. But what about the question that we should not be isolating or not be quarantining because of this?
Yeah,
so we can reconcile these two things?
Yeah, so it doesn't have to be all or none, right? Like people can quarantine, they can wear masks, and yet we can find ways to help people still have human contact. We can, at the government level, we can have policies in place that put money in people's pockets so that they're not, they don't have the added burden of becoming bankrupt and not being able to pay their bills. There are all sorts of things that we can do to minimize the psychological burden that comes with quarantining.
Fair enough. I have another question, but Sonia, you look like you had a question that you wanted to ask, so I'm gonna let you get in there.
No, I was just going to ask Lola because she had made mention from the standpoint of media and the information that people come in and it could potentially be harmful, but also from the standpoint of even conspiracy theories. And especially it seems like now within the last, 2020 and the last few years, even with our administration, that kind of thing, does that pose problems you see like in the community that you work with and trying to help them and seeking mental health services?
Oh, definitely the media plays a role and higher services play a role as well. And you're going to have conspiracy theories. It is what it is. But, if you come to me or you seek help, then you notice there's a problem. So for me, when parents or family members and things kind of force the help on them, it never works because they're not interested. They don't see a problem within themselves.
Right.
So that's the largest barrier that I have when it comes to, seeking help or getting the help that you need. Because if you don't believe in it, you're not going to you're not going to take the medication. You're not going to put in the work. You're not going to do it. So if you're a conspiracist, you don't believe in it. So you're not going to listen to me. You're going to be like, oh, you're full of junk, or you work for somebody, or whatever. So it's all in a belief, what you believe in. So until you recognize there's a problem or you hit rock bottom and say, you know what, I can't do this anymore, I need some help. It doesn't matter what you hear or what you see, you're not going to get the help you need.
Absolutely. Yeah. Jeff, Dr. Rakofsky, how do our viewers know for either themselves or for a loved one when it's time to get help? What are some signs that it's not just, oh, I'm just a little bit worried, everybody's worried, or I'm just a little bit sad, everyone's sad? When do we know when it's time to seek help for ourselves or solicit help for our loved ones?
Yeah, well, when we see these kinds of emotions or worries interfering with our productivity at work or at home, when it's starting to affect our sleep or our appetite, certainly if we're having thoughts about not wanting to be alive anymore or wondering about if life is even worth living, these are all indicators that it's best to get professional help at that point. And that maybe with the help of therapy or with medicines, that a lot of those symptoms might be able to be addressed.
Excellent. And what I love is that there are so many different avenues to seek mental help. I mean, it's not one thing. What I've learned just in speaking to some of our experts and even to some of my colleagues who are in the mental health profession, it's not about taking meds only, because there's some people who are like, I don't want them to put me on all these meds. It's not about sitting on somebody's couch and doing therapy. It's a integrated approach, and there are different things. And what I've learned, and you can correct me if I'm wrong, is that certain things that might be right for one patient are not right for another. But the main thing, it seems like, is access to care. If you think you need it or somebody needs it, seeking it, overcoming stigmas. And so I really appreciate the insight that both of you have given us about that, about when we should start looking for care, about the different modalities of care. Lola, you're coming as a nurse practitioner who's certified in psychiatry. And Jeff, you're a psychiatrist with your practice working in academics. I just feel like seeing different places that people can go and different players within the mental health care system is really important. And on that note, I wanted to thank you all for sharing with us your thoughts about what's hurting people in 2020 and how they can get better in 2020. Stick around because we want to get some final thoughts for you in a bit, but we're going to bring on our next guest. Thank you so much.
Thank you so much, guys.
Thanks.
Okay. So our next guest, we are so fortunate to be joined by, and I want to tell you a little bit about her. You can see her over here, Dr. Erica Goodwin. And I want to tell you about Dr. Erica Goodwin because I think she's going to bring a very unique perspective to our discussion. She is the CEO of Goodwin Wellness Enterprises, LLC, and Goodwin Medical Associates, LLC. Dr. Goodwin is a board-certified child, adolescent, and adult psychiatrist, as well as being a best-selling author, speaker, and integrative lifestyle coach. She's a graduate of Spelman College and Emory University School of Medicine, where she completed her general psychiatry training at Morehouse School of Medicine. She became a Gene Spurlock Congressional Fellow before training in child and adolescent psychiatry at Harvard. She's passionate about improving mental wellness, making people feel loved, cared for, and seen. And she also wants to help people see the best in themselves. How could we ask for more than that? Dr. Goodwin, welcome.
Thank you. You make me sound phenomenal.
Everything. Like, you have a laundry list of accomplishments. I am so glad that you were able to take the time out of your day to be here today. Okay.
Hey, how could I not show up for When Docs Talk?
Well, thank you so much. We're happy to have you here today. Davida, you want to start? What's on your mind?
Okay, so aside from what Dr. Yipe had already read, I was interested in you're a traveling psychiatrist. I've never heard of that before. So, of course, with COVID and everything, and I'm assuming that the change from being a traveling psychiatrist to now doing mostly everything virtually, how has that been for you?
The interesting thing is that there still can be a significant amount of travel if you choose to do it. Okay. I did do some traveling during COVID. Then I realized I just can't make it all work in my head as well. So then I was like, I'm a stay home. So right now I just work locally. But the interesting thing is, for physicians, they call it locum tenens. It's the equivalent of temping for doctors. Mm-hmm. You can do short-term contracts, and you're kind of like you're filling in for when people have like sick leave, maternity or paternity leave. Sometimes they need to hire someone left, or they've expanded services. And the interesting thing is travel during COVID, as you all know, it's very different than travel was before, because a lot of the perks were gone. I'd be on the road 9 months and I wouldn't have to make my bed for 9 months. Well, during COVID, no one's coming in your room, so your room's not getting serviced. You're not exploring the cities you're in. You're not eating out. And then you're also concerned with what are the safety protocols of where you're working. Mm-hmm. So I think in that way it's changed dramatically. And then I made a conscious decision that I wasn't going to travel anymore. I traveled for a little while, and then I was like, I'm just going to stay home, in Atlanta, for the rest of the time where COVID is janky. And then I also started a private telepsychiatry practice during COVID.
Oh, okay.
Oh, that's amazing. All right. Same question to you to start off with. What's different in 2020? What are you seeing?
If I had to say what's different in 2020, it's literally everything. It's all coming at the same time. And I think the thing with 2020 is I try to encourage people, don't make that statement, what else can happen?
Right.
Because we turn around and something else happens every time. There's something, I feel like something happens every single week. There's
every week
someone dying. People are having all these losses. We're dealing with the racial injustice issues. We're dealing with COVID. You're dealing with how does this all plot out long term when you don't quite know when it's ending. And I think what's different is that people are emotionally raw right now because it's been so much. So I look at it as a concept that a lot of people's emotional reserve is not there. So people that would have before either had a full cup or at least been on 3/4, which is why I think the racial injustice is hit different, because a lot of us know that, especially being Black in America, they've been killing Black people for centuries.
Right.
It's not new, but a lot of this hits different. Number one, because it's, as Gil Scott-Heron said, the revolution will not be televised. Well, this time it actually is.
It is.
and the blatant disregard for human life that people are seeing is hitting a higher level, because number one, people, you're looking at it, and you're like, I know people see you. But just, you're on that dude's neck with your hands in your pocket chilling.
And he's still doing
it.
And I think what ended up happening is, because people were already worn down from COVID, that when the racial injustice has continued to amp up, that people didn't have that resistance. So the thing I'm going to speak to is the fact that, especially for people that are Black, is that people don't have the energy to wear the mask anymore. So the way people could kind of hold it together and it's like, yeah, I had a bunch of microaggressions or it was racist today, but I can keep on pushing. I'm going to smile and I'm going to do my job. And hello, everyone, how can I help you?
A lot more difficult.
Is that now people are like, I don't know about y'all. You have days at work, you're like, I just feel like crying. And I don't have a mental health issue right now. It just feels like too much. And I think the difference now is it's hitting that way for people that are directly affected. And then people are starting to have awareness they didn't have before. So then you have people that desire to be allies that are like, well, we didn't realize when you were talking about this before, it was real.
Yeah.
So I think it's the cumulative effect, because you're not just dealing with one situation, that these are almost like having multiple trauma.
Back to back, almost.
And each one is tied with so many losses. People have their personal losses as far as people they know that are dying from COVID or otherwise, because adulting in life didn't stop just because COVID started.
Right.
And just because they're killing people, life didn't stop. And people are dealing with all of this at the same time. So I think what we're seeing is all these people that either previously didn't have mental health issues, where they'd be just a little anxious or something, it was workable, all now looking to seek treatment or messaging all of us like, hey, what do I do? Or my kid's all stressed out, or no one wants to do their virtual learning. And you're seeing this uptick of people that previously weren't dealing with these issues, all coming forward and actually seeming like they're ready to get help, because now it just feels unmanageable.
Absolutely. You said something that makes me want to transition to the next point. You talked about virtual learning, and that makes me think about my virtual learners, my children.
Bless you.
Which, yes, I need the blessing. But I know that you have studied child and adolescent psychiatry, and I'm really curious to know, and believe that a lot of our viewers want to know, what your perspective is on what kind of mental health challenges, I should say, our children are facing.
Well, it's a huge change. And naturally, as adults, we have a capacity to have abstract thinking that the average child is not going to have. A lot of the capacity for abstract thinking starts in their teens. So this isn't stuff and it really develops more in young adulthood. So they don't fully, number one, understand what's going on. And then time moves differently for children. So you have little kids and they're like, you put them in timeout for 1 minute and it was forever.
Right.
So a lot of them, it's just the kids don't understand the grip of it. So I think it's a huge thing to be having the separation, because that's where a lot of their social contacts were. And then children that are in transitional ages, that when they left school in the spring, if they didn't go back physically this fall, then that was the end. They didn't see anybody. They're not, and especially if you're living in neighborhoods or things where there aren't kids or you weren't necessarily connected, is that it's stressful because it's new, and some kids thrive on that social connection.
Of course.
Some children are not going to be as prone to being able to manage virtual learning, that depending on how kids take in information, whether or not that kind of works for them, a kid that likes to have a little bit more movement is not going to be happy sitting in front of a TV screen. And you're going to see a lot of kids, and we're already seeing it, where they're having tantrums or they're upset. They're like, I don't want to do this.
Right. Mm-hmm. Sure.
And then the challenge of the fact that a lot of adults are working from home at the same time. So they're looking for how can they support their child, because especially if you don't have teenagers and you have, or like tweens, if you have little young kids, it's not like you could sit them in front of the computer and say, Zoom away.
Right.
I'll check on you when I take my lunch break.
Right.
Send me a text if you can't figure something out. That it's almost like, I put it like when you have kids in timeout, when they're in timeout or they're in punishment, so are you. That you find with a lot of families, that when these kids are virtual schooling, everyone's held hostage with that computer, with that
everyone.
During the whole thing. And the struggle is real. Those memes of all those parents on the side sitting there like, because they're stuck sitting there the whole time, because these kids can't stay on task, and different people are going to have the ingenuity to be really creative and be able to engage kids, but it's not the skill set they originally had to have to teach.
So how do we help the children with some of the things that you're talking about, in these days? That's what makes 2020 particularly challenging is, one, we recognize some of the challenges. So first of all, getting to what's challenging us and really conceptualizing what is really the problem, that's the first issue. And then when we figure out what the problem is, what do? We have these constraints that I think we've never had in 2020. So how do we support children and adolescents, family members, or whomever who are in that subset of children and adolescents who are struggling because of any mental health issues that 2020 is bringing?
I'd say the first thing is number one, keeping in mind that these are unusual times. The solutions you need day to day may change. So being able to give yourself grace and give your children grace, because the solution that worked yesterday may not be the solution that works the next day. So the first thing is kind of holding on to what you are in control, given that a lot of the crux of what's going on is the uncertainty itself. Mm-hmm. So on one hand, when it comes to managing virtual school is making sure you're on top of what the expectations are. You're in touch with your kids' school, their counselors, their principals, so that you know exactly what's going on, that you're also aware of how much they can kind of sit for a second and when they need breaks, so that if the school's not doing it, you can do it.
Absolutely.
Also find things to do together with them so that their life isn't just school and being idle. So and finding ways to, not the same as rewarding kids for good grades, but doing special things or spending time with them so that there's kind of a payoff at the end of the day, and letting them be in control of something. So maybe they can pick a theme for dinner or a meal, or you could still do thematic clothing days, pajama days. They'll be fine. It's on Zoom.
Yeah.
And then for a family, it helps give the child back control. And also listen to the child. If the child seems out of sorts or your kid is acting different, because no one's going to be an expert on your child like you are. Is if you notice your kid's not sleeping, or just the side of the computer makes them cry, or they don't want to sit down. A lot of them will just say they don't want to do it. And they're not, I think I said not sleeping, if they're not eating, or they're just acting out, or you notice they just are crying a lot more than
some of the things that we would look for in adults, not sleeping, not eating, crying more, the tantrums that you mentioned. I want to put this back up, actually. One of our viewers wants to know, what about kids that are coming from troubled homes and have, and they don't really have, or I don't know if they meant they would like to get mental health support at school. What would be your recommendations there? Because there are a lot of people, not just kids, people who are in abusive situations or what have you are having trouble. But since we're focusing on children, what are your thoughts on that?
Well, one of the complicated things right now, and I think one of the hugest challenges that the school system and social services is facing, is the fact that school was one of the main places where you identified when a child was neglected or abused. Mm-hmm. Mm-hmm. By switching to virtual and the kids not being there, people don't have the same contact with the children to be able to potentially report things or enter into child services for additional support. The one thing that is happening, though, as far as with the schools, even though they're switching to virtual, is most of them still have a significant companion set of services, so that they still do have counselors and other supports. And the ones that contracted out, still, most people have switched over to virtual, as Dr. Metzger had talked about earlier. So one of the things is, when these kids start having difficulty, is going ahead and reaching out. Now, the other thing we do mention is they're working on putting systems in place of how people can report there's a problem if they can't easily do it at school.
Okay.
We're talking about issues also not only with children that are abused, but also battered wives.
Yes.
So I know they were working on some ways for people to possibly signal people, like at pharmacies and places like that, as an alternative, since the school just doesn't have the same capacity as it did before. Now, as far as if kids are just dealing with some trouble or some difficulty, they can still reach out to their counselor. And a lot of schools do have a creative way that they're doing wraparound services, and the services they can provide, they may be able to assist with referrals to other providers that are outside of the school,
right,
to problem solve.
Okay. Davida, do you have any other questions? Because I wanted to put up one thing before we thank our guest. What question did you want to ask?
Well, I didn't have a question, but unlike Dr. Yipe, I don't have any children, but I do have nieces and nephews. And a lot of stuff that you touched on, I definitely want to either sit down with my brother and his children and like express my concern in those ways, especially since even though right now we may not recognize these issues, but to just be abreast on what could possibly happen. So thank you.
Oh, you're welcome. And the one thing I would always say is, if you have a question, ask, because a lot of times kids will tell you. If they won't tell you directly, you play with them, you color, and you ask while they're distracted.
Yeah.
But a lot of times people will just assume a child is okay. So, the thing I encourage is to ask and actually talk to them.
Yeah,
absolutely. Well, speaking about ask, I wanted to let you all know where you can find Dr. Erica Goodwin. You can actually seek her services and find out more about her at askdrgoodwin.com. I want you to also know that she has written a book called Fix Your Fairy Tale, A Woman's Guide to a Great Life, Love, and Legacy. And you can check out that book at fixyourfairytalebook.com. This is a very busy lady with a lot of great insights, and we're fortunate to have her. Thank you so much, Dr. Goodwin.
I'm so honored to be here. Thank you so much.
All right. All right. We are excited for our next two guests. I know them personally, and they're wonderful. They have a lot of knowledge between the two of them, and they're going to drop some on you. So let's start out by introducing Dr. Urakabong Ikwe Welch. Yes, you did hear Ipe. Yes, that's the same Ipe. This is my lovely sister, and she is a phenomenal woman that I'm excited to have on the show. I've been telling her, don't think you're going to not make it on my show one day, especially if we talk about mental health. So here she is. And let me tell you a little bit more about her. Dr. Yipe Welch is a clinical psychologist who's currently working with a healthcare company where she holds a leadership position in the mental health program. She has been in the mental health industry for almost 20 years and working as a psychologist for approximately 10. She received her undergraduate degree from Johns Hopkins University and her doctoral degree from Nova Southeastern University. She holds a law degree as well from the University of Miami, and has often had work which focuses on the intersections of mental health and the legal system. She presently lives in Nashville, Tennessee with her husband, Justin. Welcome, sis.
Thank you. Thank you. Great to be here.
Hi, and I'm going to introduce Dr. Marva Robinson. So Marva Robinson, PhD. She's a licensed clinical psychologist. We're very fortunate to have her tonight. So Dr. Robinson, she works as a full-time primary care psychologist for St. Louis Veteran Affairs, and also as an adjunct professor at Weber University in the Graduate School of Education. She also runs a private practice at Preston and Associates Psychology Firm, LLC. She proudly served as the St. Louis Association of Black Psychologists as president. And at that time, she mobilized her chapter to address the community crisis in Ferguson, Missouri. As the chapter president during such a highly publicized event, she narrowed her focus on three tasks, which were immediate intervention, building a platform for sustainability, and long-term solutions for the community of Ferguson and the greater St. Louis area. In order to tackle these tasks, she worked with her chapter and the community at large. She built relationships with entities like the local clergy, social activists, and other social service agencies. The notoriety of her work highlighted her as a leading expert in the area of providing crisis management services, which lead her to working in the community in a lot of communities across the nation. So once again, Dr. Robinson, we're very, very fortunate. We're very happy that we have you here tonight. We have a lot of crisis management for 2020 that we need to deal with.
A lot.
Absolutely. Yes.
So why don't we jump into that and just talk about that crisis management? Since we're talking to you, Marva, first, we talk about the kind of work you do. Have you been working overtime with crisis management this year?
I think the answer to that is yes, not only for me, but for my colleagues as well. Different types of crises that pop up. People respond to different things differently, different sectors, but definitely multiple crises nonetheless.
Okay.
Yes. Well, I guess even from the standpoint right now, I know this is just me personally. You know, definitely we think about COVID because we work in the healthcare system, but I have to admit from the standpoint of just socially what's going on, especially in our community. A lot of the incidences with police brutality, the killing of innocent, unarmed people, of our Black men, as well as also the political climate right now.
Sure.
With the election coming up, what's been going on from the standpoint of even, I guess, specifically where you're working in your practice, with all of that that's going on right now?
Well, one of the other guests earlier mentioned about conspiracies and a lot of the unknown factors. So what tends to happen is when there is news that goes out and bits and pieces of information are fed, people are left to fill in the gaps for themselves.
Yeah.
Before you finish creating a theory of what happened to scenario A, B has popped up. And so now people are trying to sort out what's going on with B. Definitely during these times, it's been challenging, especially for Black families, seeing a lot of the killings that have taken place that are public, also dealing with health disparities and challenging times of, can you get tested for COVID? Where do you go? Finding a doctor that's willing to hear and listen to you. And on top of that, being parents and dealing with virtual schooling. So
Yes.
it definitely is the trifecta going on, and it hits our marginalized communities more than anything.
Yeah.
I want to switch gears a little bit because I had you all together for a reason, not just because you've been friends for many, many years, but because you're both clinical psychologists. And I think that when we talk about access to care, one of the problems is that a lot of patients don't realize who the players are in healthcare and what the different roles are and how they can select these providers. And so I want you, Uduak, I'll start with you, Dr. Uduak, if you can tell me a little bit about what distinguishes clinical psychologists, and how a patient can access them, when a patient would access a clinical psychologist versus, say, a psychiatrist.
Okay, well, again, a psychologist is going to focus a lot on assessment and testing, whereas your psychiatric provider, that would be anyone that's a psychiatrist or psychiatric NP, is going to be able to prescribe medications and is going to focus very closely on the medication management portion of a patient's care. While a psychologist is going to look a bit more at the testing, helping with diagnostics. While both can diagnose, that is more of the area in which a psychologist would operate. You can, I believe one of the doctors, I think it was Dr. Metzger, talked about a way that you could reach out through a Psychology Today in order to find a psychologist or a psychiatric provider. So that's a great way to be able to get those resources, also through your primary care physician. That's another way. For those of us who come from population or communities where we don't really have insurance, you can always reach out to your community mental health center as well in order to get mental health services, even if you don't have private insurance or feel like it's something that's affordable.
Your community mental health center. So like I would Google Atlanta Community Mental Health Center and I could find resources even if I didn't have insurance, which is really important because a lot of people have lost their insurance during this pandemic. So is that what you're saying?
Yes, absolutely. You can go ahead and Google, and there's going to be one that's kind of like in your catchment in your area that you would go to.
Okay. Marva.
Yes.
What is the biggest challenge to delivery of mental health care in 2020 for you?
The biggest challenge. I'm fortunate enough that I work in primary care. So a lot of the patients I see are referred to me from their primary care provider. Mm-hmm. The biggest barriers are people being aware of where to get a clinician and what would qualify you to reach out to see a psychologist. And the answer to that for me is anything, right? So my goal when I see patients or talk to people or do any type of community work is you don't have to diagnose yourself first or determine if you're worthy of seeing a clinician first. Just give us a call. We can have a general conversation, and from that, we can determine on what the next steps can be. Oftentimes, someone may think, well, I'm not suicidal, so I don't need to see anyone, or I'm able to sleep at least one good day if I crash, so I really don't need to see anyone. And that may not necessarily be true. So I think sometimes people kind of cut themselves off from the need to speak to someone before we actually get a chance to have a conversation with them. And I also just want to add really quickly, adding on to what Dr. Yipe just said, is people can also go to the website for the Association of Black Psychologists. You have some individuals that prefer to see a psychologist. And so we have a listing for every state where you can find a psychologist there as well.
Do you think it makes a difference, Dr. Yipe Welch? Do you think it makes a difference whether or not a psychologist or a counselor or therapist or psychiatrist, for that matter, anyone who's involved in your mental health care, does it make a difference whether they look like you, whether they are a woman, whether, whatever links you or bonds you to that person in terms of how you look, where you come from, background, is that important?
What's important is that you, as the patient, the person who's receiving the care, that you feel comfortable. And that can be with maybe someone that's the same, ethnicity as you, speaks the same, native language as you. It may be someone that's the same gender, sex as you, but it may also be that, you feel comfortable with a therapist who, is of the opposite sex or is of a different race. Really, it just depends on what is most comfortable for you. And I think people have to make sure that they feel comfortable. You don't want to find yourself in a situation in which you have a therapist who maybe doesn't look like you and you're not comfortable with that and you don't feel like saying something. If you're not comfortable with that person, you want to be with someone that, has some shared experiences in terms of history and how you see the world, whether it's religious, what have you, then I think that that's really important that you reach out and get matches what your needs are. So it really does depend, and it's up to you as an individual to feel comfortable saying, this is who I want to see, or no, I don't feel comfortable.
Okay.
I had a question for Dr. Robinson. I saw in your biography that you had worked in cooperation with local clergy. And so from the standpoint of that, their role even in helping and assisting with counseling and behavioral health. I know a lot of times when I was in family practice, a lot of people, and once again, it has to deal with stigma, but they felt a lot of times even better or a little bit more comfortable, especially when it came to a little bit more their spiritual needs. And going to local clergy and going to their local churches and that kind of thing. And I didn't know if you could speak on, a little bit on that from the standpoint of, do you do work in kind of cooperation with some of the local churches and things like that?
Absolutely. I think it is critical, especially if you want to consider yourself a clinician that has roots in the community.
Mm-hmm.
Not only aware of the local clergy, but the community health centers that are around,
Mm-hmm.
social workers, school districts, resources in general. What I was referring to is in 2014, having close relationships with a lot of the local clergy. Sometimes individuals tend to seek services through their pastor, their pastoral services first. That's kind of like their first main support. And so I have been lucky to see in St. Louis where the local clergy here are extremely supportive of referring individuals to mental health clinicians, such as the St. Louis Association of Black Psychologists. The ones I've worked at understood that there is sometimes this boundary where, yes, that faith-based resource is needed, but then sometimes symptoms kind of cross the line where a professional is needed. That's been big. I mean, even the church that I attend, there's a huge presence and talk about mental health, seeking professional care. And so that's kind of been the push. And so being able to work with clergy hand in hand has been a critical part of being able to help a community heal.
Do you feel like that's new? I know even my church now, my pastor, he even says, hey, I go to a therapist. And to me, I know it sounds it's very refreshing because once again, he's a very strong Black man, and he's saying, hey, listen, even I have to go see somebody and talk to someone. Do you feel like that's something that is new, and if so, great, and is moving in the right direction?
I think it definitely is I can remember before I even started grad school that not always being the case, that people were receiving the message that if you're sad, pray on it, or you're not strong enough in your faith, or
Right, right.
kind of being weak in your faith to go and seek help elsewhere because you do it all within the Lord. Now what I'm seeing, and if I can just say, for instance, at Friendly Temple Church, which is one of the largest churches here in St. Louis, the bishop there is very open about seeking professional help. It's okay. And I have been to other services where pastors will openly say, I even see a therapist. And whenever you can have a pastor or someone in authority say that,
yes,
the ultimate win-win.
Absolutely.
People really like, oh, okay, well then it really is okay.
Then it really is okay. You know, I'm so glad you mentioned that, because we're talking about barriers to mental health care, and there's cultural barriers and so forth, and then there's the barrier of access, and then there's the barrier of believing that you're somehow either weaker or disappointing people. You mentioned the barrier of thinking, oh, if I seek mental health, that means I don't have faith in God. There's another barrier and another group of people that I think may need a little bit more direction, and that's actually healthcare workers. You know, I feel like sometimes there are barriers that we have in general to seeking care. So I want to actually turn to Dr. Yipe Welch, because I know that we've spoken about how there's something, what did you call it, compassion fatigue, and certain things that can happen when you're seeing on the front lines or in healthcare or any high stress profession. You're seeing things often and you still have to care for somebody, take care of a patient. So I want you to talk a little bit about that. And then I'd like you to guide us through some of the relaxation and stress relief exercises that you've talked about that you do with your healthcare team. And that's the people that you direct when you work with them in the mental health program.
Right. Well, right now with everything that's going on with, the pandemic, and also with a lot of the things that are going on with the social unrest in our communities and everything, what I found is that our healthcare workers, our frontline workers who are seeing patients every day, are experiencing high levels of stress. Anxiety, fear, and that sort of thing. And, stress is something that you guys are all familiar with as doctors, happens, physiologically when you think something, your body is trying to fight something that it thinks maybe is too great or out of your control, right? So you find yourself bracing, right? You're trying to, you're ready to, your fight or flight, I guess, comes on, right?
Sure.
And so you have that response, but your body cannot tell the difference between the fight or flight response and when you're just stressing out because either you're dealing with patients for a really long time, or you're dealing with, hearing something very difficult or hard on the news. Your body's going to react with stress in the same way. So now you have your healthcare worker, they come home from work and they're hearing all sorts of stuff on the news that is very stressful and difficult for them. They come into work, they're dealing with their patient population, and they're concerned because of the pandemic. They're concerned for themselves, they're concerned with their patients, they're concerned they're going to bring something home. I mean, just think about all of this stress that is being leveled on our healthcare professionals. And so, yes, at some point or another, it becomes where, it's almost like your cup is now empty and you don't have anything to give. And so that's kind of where that compassion fatigue comes in, where you're constantly giving and giving, and then there's nothing left. And when you run out, then you have nothing to give to your patient, right? So it's really important that our healthcare workers start to think about themselves and their wellness and their self-care. I know particularly women who are caregivers and so forth tend to put themselves last, not think about themselves first.
Absolutely.
And it's really, really important to take that time to stop and think about self-care and your own wellness.
Awesome. Thank you so much. I want to thank you, Marva, for joining us. Stick around, Urak, because you promised us one of those relaxation techniques for our viewers. Marva, stick around too in the backstage, because we're going to bring you all on for some last thoughts. But Urak, Dr. Urak Yipe Welch, please take us to some of the exercises that you say you do with your clientele and with your the people
with our team members. So
team members, okay.
What research has found since COVID has come out is that, a lot of workers are spending time wearing stressing out. They're spending working hours doing that. And so when we would go out to the sites to see our staff, they're all burnt out. And so we decided that we were going to start doing wellness exercises. So whenever we have large meetings, we go into and do breathing techniques. We'll do progressive muscle relaxation, different types of things that we can do to help reduce stress. And so what I want to do with you guys today is give you some stuff that you can work on your own and then utilize also when you're in real life in situations in which you're starting to feel a little bit more stress and anxiety. All right.
You ready, Sonia?
Yes, I'm ready.
All right, you ready, viewers?
So what I'm gonna do is I'm gonna explain what we're gonna do first, then I'll demonstrate it, and then we can do it together maybe 2-3 times. Okay.
Sounds good.
So the first thing is paced breathing. Okay. It's really important that you are aware of how your body, your heart is connecting to your respiratory system, and breathing will help to activate those stress reduction mechanisms. So the first thing we're going to do is we're going to put our hand on our chest and then one hand on our stomach. Now the reason why we're doing this is because we want to make sure that we're utilizing our stomach and our diaphragm, that we're breathing, getting full belly breath, and that we're not necessarily getting it up in our chest. We don't want our chest to move too much. We want that belly to be going up and down. So that's why we've got our hands here. So we're gonna have our hands on our chest and stomach. We're gonna breathe in for a count of 2 to 4 seconds, and then we're gonna exhale for 4 to 6 seconds. Okay. Now you can find any combination that works for you. You might go breathe in for 4, breathe out for 6. What you want to make sure you're doing is that the inhale is shorter and the exhale is longer. And as you breathe out, you might choose to say something to yourself like calm or relax or breathe, something as you're on your exhale that makes you feel calm, relaxed, at peace. So I'm going to go ahead and demonstrate first. Okay.
Okay.
And for this, I'm sorry, I forgot to tell you, you can either have your eyes closed or maybe lower your eyes if you like. If you're not comfortable with that, you can go ahead and leave your eyes open. All right, so. Let's do it together. Try and concentrate on the feel of your breath as it goes in your nostrils and comes out of your lips. Let's do one more. So if you try this a couple of times, in the week, maybe in the morning when you wake up or at the end of the day in the evening, just going through these breathing exercises, you'll find that when you're in a real stress situation, you won't have to put your hand on your head, your chest or anything like that. You can just stop and take those deep breaths, and recalibrate things. And you'll find that that really does act as a stress reliever in real time. And the practice of it also is going to just help to keep you in a more balanced and rejuvenated feeling throughout. The next thing I wanted to do with you guys is progressive muscle relaxation. You're going to continue with the breathing that we just did, so that steady, even breathing, where you're breathing in and exhaling, a nice, long, heavy exhale, and you're breathing with your diaphragm. Now, remember, this is not about, just putting yourself in any discomfort. If you have any physical injuries or anything like that, please don't do anything that might make you feel uncomfortable. This is relatively easy, but just wanted to put that out there for you guys. You want to try and minimize your distractions, put yourself in surroundings that are nice and quiet, perhaps lower the lights, things along those lines. And what you're going to do is basically you're going to squeeze your hands. Okay, what we're trying to do is we're trying to see the difference between tension and relaxation, because when you're stressed out and you're feeling a lot of anxiety, oftentimes you will have a lot of tension that's built up. You come back from work and you're like, I don't know what I did, but I'm exhausted, right? And the whole day. So now what you're going to do is go ahead and squeeze as hard as you can for 5 seconds. You're still going to breathe though. And then as you exhale, release. And what you want to focus on is the feeling of the blood rushing back into your fingers, if you have any tingling, anything along those lines, you want to feel all of that. So you're going to squeeze the muscle group as tightly as you can for 5 seconds, and then focus on the feelings and sensations of release. And you can do that with all these different, with all of your body parts, right? You can make a muscle with your arm. You can squeeze your eyes together in your face. And if you continue to do that on a regular basis, what you'll come to find is that you will have a lot more, well, first of all, you'll be able to recognize when your body's tensing up. And then you'll feel more relaxed throughout the day.
Great. I like that you can use other muscle parts because, you know, something like the face, like I'm thinking about things you could do even in your work setting, like in the emergency department. You know, I might not be able to stop in front of everyone and start doing breathing, but, you know, if my hands are pretty discreet by my side, I can do that. So I like the fact that we can do kind of these discrete ways of recognizing tension and releasing it.
Right.
You know? So you said, how many seconds do we squeeze roughly?
We squeeze for 5. And then you want to focus on the relaxation and the release of tension for 10 seconds. Okay. And as you release that tension, you want to be doing it on your exhale. So you're saying something like relax or calm or peace or whatever word works for you in order to get to a good place.
Well, let's do one together before we have you leave the stage. Just one. Let's squeeze whatever you want to squeeze, people.
All right. Yeah.
Tanya, what do you squeeze? I'm doing my hands.
I'm doing my hands.
Okay.
I'm going to go ahead and squeeze in my stomach area, okay?
Oh, maybe I should do that.
I should work on her hair.
Does that have like dual benefits?
What you want to do is you want to go ahead and just breathe in. It's kind of like, you know, you're squeezing your stomach, right?
Okay.
So kind of like tucking your stomach, and you're going to tense those muscles in, like making your core really strong. And you hold it for 1, 2, 3, 4, 5, and relax.
And you said to do it with the breathing
With
out.
the breathing, exactly. Telling yourself relax or calm as you let it out. You can do that.
That does feel very good, actually.
Yeah. And so if you practice that, give it just a couple times a week, you know, you'll find that it becomes easier to do, and you'll continue, like I said, to have like that feeling of rejuvenation as you go on through your days.
Awesome.
I just wanted.
Sorry. I think you wanted to that. Yes, I'm going to put that up right now. Is you're referring to the sites that you're talking about? So Dr. Yipe Welch wanted our viewers to know that they do have apps out there that can help you through these relaxation, meditation techniques that have advice for sleep and so forth. One of them that she mentioned was headspace.com. And all of our healthcare workers out there, there's a special promotion going on right now where you can actually access the app for free, provided you have an NPI number or if you are a US-based practicing RN. So that's headspace.com. And there's also calm.com. I've seen some commercials for that on television too. So those are 2 sites that you might want to check out to help with these, because we all have heard from pretty much all of our experts that relaxation and let me say the anxiety is high and that we need ways to kind of relax and de-stress. So we'll try some of those exercises that Dr. Yipe Welch has shared with us, and also check out some of those websites that she's recommended for us. Thank you so much, Dr. Yipe Welch. Don't go anywhere, because I want to bring on our guest, all of our guests. Let me just put up their pictures here. If you can join us on stage, I would like all of our guest experts to give us some closing thoughts, some last minute words for our viewers. What are some tips on thriving and surviving from a mental health perspective in 2020? Here we go. Hello, everyone. So talk to me, Dr. Rakofsky. Give me one tip for our viewers that you want to leave. You're on mute.
Yeah, reach out to family and friends. Find people to talk to, whether it's virtually or even in person. If it's in person, make sure that it's done safely, wearing masks, keeping distance. Really reach out, because isolation could be deadly.
Wonderful. Thank you for that.
Sure.
What about you, Dr. Marva Robinson? Tell me what you want to leave with our viewers.
I want the viewers to know that 2020 doesn't have to be the year that you want to forget, right? We are in a very unique position to do what I like to call the 3 L's, right? Lean in, right? What things about you do you need to reflect on a little bit more? Learn, not just learning more about you, but learning about others and also loving, right? We are humans that are built to love. And so are you sharing that with those who deserve to have it? And so during the time where we are alone, you can journal, write some thoughts down, set goals for yourself. Think about all the things that you enjoy to do that you can still do. You just have to add a mask or less people. So really take this year to really spend some time in reflection so that 2021, you know more about you and you're more ready to tackle life than you ever have been.
I love it. I love it. Dr. Goodwin?
Sure. Well, the great thing is Dr. Marva took part of what I was going to say, so then
Sorry.
Oh, no, don't apologize. I had other stuff in my head. Just give me something else. So I would say that there are 2 things that are going to get you through this. One is grace, and it is important to not just have grace for yourself, but for other people. No one has done this. Everyone is doing something new. The expectation that everything be perfect is going to drive you 100% nuts. The second thing is asking for help. And it's, an entire talk could be on the continuum of ways to ask for help. But since we're talking about specifically some of these mental health things, that there are times where no amount of Oprah, Ayanla, Tony Robbins, or Deepak are going to get you through.
Right.
And if you find yourself in a position where you just feel like it's too much, as Dr. Jeffrey spoke about earlier, ask for help. It's much easier for all of us to help someone on the front end than when it's a crisis. It's kind of like if you gain 2 pounds and you need to lose 2 pounds, it's a lot easier to lose 2 than 50. Right. So reach out when things are little, and then we can get you fixed up really quickly, get you back on and living your life.
Wonderful. I love that. Ask for help. What about you, Dr. Yipe Welch?
Well, I would just say that you should give yourself permission to take care of yourself. Challenge yourself in the next couple of weeks to think of something that you could possibly do that would improve your self-care or your wellness, whether it's taking more walks or playing with your children or reading a book, taking on a new hobby. Just try in the next couple of weeks to think about ways that you can take care of yourself and go for that. And if you are feeling, like you're having thoughts of, that you need help, or someone else that does need help, or having thoughts of self-harm, please reach out to the National Suicide Prevention Lifeline. That's at 1-800-273-8255. Or reach out to, your local healthcare provider if you have one. But please seek help if you need it.
Definitely. And we'll be posting that National Suicide Prevention Hotline up on our website as well. Lola, I see you here with us. Here we go. Why don't you leave our viewers with the last thoughts that you have for them?
Mental health is real. If somebody tells you that it's not real, you tell them, hey, it's real. And I think that's the best thing that I can say because of the stigma that's attached to it. Just to know I'm not feeling good. Something is wrong with me. I need to see someone.
Absolutely. Definitely giving it the weight and the attention that it deserves and overcoming any sort of stigma that people might have about it. I love that too. You all are amazing. I appreciate you so much for being here. I am going to actually invite our very last expert who's not here among you all. She also had a pre-recorded session and she had some wonderful things to say. But before I do that, thank you all for joining us. Continue to help us because we need that help as a community, as a nation. We need people like you more than ever. So thank you for the work that you do.
Thank you for having us.
Thank you for having us.
Thank you. Thank you.
All right. Let's talk to Dr. Omarine Asay. I want to bring on our special guest. This is none other than Dr. Omarine Assay. Dr. Omarine is a board-certified family medicine physician and certified emotional success coach. She's also a leadership expert with the John Maxwell team. As a leading authority on anxiety and wellness, she's been recognized in several articles, including Forbes magazine. Through You First Concierge, she offers customized solutions using a holistic approach to female executives and professional women over the age of 40. As a result, they are able to gain influence, income, and feel fantastic again. Dr. Omarine has close to a decade in practice of medicine and has treated over 20,000 patients. Her approach to medical care is to find the root cause of any illness. As a best-selling co-author and global speaker, Dr. Omarine delivers actionable and real-world strategies in a practical, fun, and engaging way. Her mantra is thrive regardless. You can connect with Dr. Omarine, MD, on all social media platforms or go to www.dromarinemd.com. I am so excited to have her. Without further ado, let's go ahead and bring this lovely lady on. Dr. Omarine, welcome.
Oh, thank you so much. Thank you so much for having me today.
It's a pleasure. It's a pleasure. So I want to jump into the nitty gritty because we're talking about 2020. 2020. Tell me what you think is the biggest challenge to emotional wellness, or some of the biggest challenges, because there may be many, to emotional wellness in 2020 from your perspective as somebody who is an emotional success coach.
I think 2020 is an amazing year.
Oh,
know why?
Amazing.
We've had the opportunity to stop.
Oh,
to pause. Take a pause. Yeah.
A lot of times we're just on autopilot. We're just going and going and going and going. Especially women, especially Black women, especially women who have children. You wake up in the morning and you just say, you may not be feeling well or what have you, but you push that down. Especially professional women, especially physicians. We push it down because we don't have time for that. We don't have time for emotions. We push. So 2020 has uncovered some of the things that we need to deal with. So because of that, I think 2020 is a fantastic year.
You might be the only person that I have heard say that. But I love your explanation for it. I love that perspective. I have to admit, there are some times during this whole thing since about February, March, when I've been like, you know what? There are some blessings here. I have a little bit more time to see my family because my kids are home, virtually. I can put a pause on things and really reflect on what is important and what is not. Because there's so many things that when we're in the rat race, oh, this is so important. Oh, we got to do this. And when you really look back, it's not that important. It'll be there. It's fine. So in that regard, I have found 2020 to be good because it has made us reflect. But Dr. Omarine, talk to me about what some of your clients are saying are their challenges in 2020.
The biggest challenge is that they feel trapped. They feel trapped. I have one of my clients who, she has an autoimmune, disease, and unfortunately, she can't see her family. She can't connect with them, her grandchildren and her children, the way she would want to. So that outlet of being able to just leave and go, it's not there. I'm really focused on the doctor-patient relationship.
Yes.
I'm building from there. And I'm asking all my fellow doctors, please find a doctor to be your doctor.
I love that, because that's actually my next question I wanted to ask. Do you think that healthcare workers, other physicians, nurses, nurse practitioners, PAs, do they have unique challenges, not just in 2020, but especially in 2020? Frontline workers. Tell me about your perceptions about that, because it sounds like you're saying, physician, heal thyself, and encouraging we in healthcare to also take better care of our emotional wellness.
Yes.
So do you think we have unique challenges?
So a month ago, a radiologist, a 38-year-old radiologist who was on call in the emergency room in a hospital in Houston, went into the bathroom and cut his carotid arteries. He was, how they found him? the ER doctor was like, oh, you know what, there's backup of, the x-rays are not being read, the CT scans are not being read. And they went to find him, couldn't find him, went to the restroom, and there he was.
Oh my Lord.
Very strategically, because he knows where they are. Cut his carotid arteries and bled to death. 38 years old.
38 years old. One statistic I saw just thinking about that is that physicians, I know specifically women physicians, when they actually attempt to kill themselves, they are successful. And that makes sense, right? We know how to kill ourselves. So when it may be that we might have as many, might not have as many attempts as the general population, but when we go for it, we go for it. And I imagine that would probably extend to all healthcare workers. That's a terrible story. So it sounds like you're saying there's a lot of us in this field of medicine that are hurting, and we don't find out till we find them in the bathroom of an ER with their
emotions, and doing everything. They're not actually addressing any of their issues.
Exactly. 25% of physicians don't have a primary care physician, and can do it. But the problem and I'm going to say this because I want more physicians to say this also. Okay. I see a therapist. I'm Dr. Omarine, and I see a therapist because we absorb a lot of shock. As physicians, especially this year. We've seen so much death.
Yeah. Oh, yeah.
As Black women, as mothers, we absorb a lot of shock.
Yep.
So if more of us will come and say, hey, I have gotten help too, just like the Me Too movement. I see a therapist.
Would you say, I mean, you're coming from a nursing perspective, would you say it's the same sort of thing where it's taboo to seek, within the nursing profession, taboo to seek mental health care? Do you have some sort of place on your recertification where you have to state whether you've been hospitalized or treated for mental illness like we do?
Yes, you do. Also, I wouldn't say that it's more taboo for nurses to come out and say that they're actually seeking mental health resources. I think it's more, especially in the ER, I will say, you're kind of looked down upon if you're not able to cope well when you have a trauma and you have to go to another patient. It's like, okay, you had that, like it's normalized. You're supposed to just suppress your feelings about whatever is going on and move forward. Otherwise, if they're saying, you can't handle it, you need to go to another area of nursing. Or like, why is it affecting you to the point where you can't like move forward and do what you're getting paid to do?
Right.
Even when I'm thinking back on like my worst traumas, it's been situations like, okay, well, it's been a while, like you get into the next trauma, like I need you to basically suck it up.
Absolutely.
So I do think that I think the majority of the people that I work with, either they have in the past seen a mental health specialist or they're actively seeking mental health specialists, especially like with coronavirus and everything that's been going on. Like this is unheard of. Like the way that, like you've seen death, okay? You see death all the time, especially the emergency department.
Right.
But the way that we're seeing people die,
it's different. It's different. It's definitely different. I want to know if there's any last words that you have for our viewers out there on staying mentally and emotionally well in 2020.
Well, I'll take a few minutes and tell you a story. By the time my grandmother was 21, she was left, she was left pregnant, homeless, with 4 kids. And this is because she was born in a time when women could not inherit land. And so when her husband was murdered, she could not inherit his land. And so when I was 13, based on her experiences, she told me something. And that's where my mantra, thrive regardless, comes from. My grandmother said, and it's an African proverb, which you may know, and it says, no matter the economy of the jungle, the lion will never stoop and eat grass. And it doesn't do that because it doesn't occur to him. It's like, I'm not going to see a bark and start chewing on it. I want to look for my next gazelle. Exactly. So look for your next gazelle. Look for your next gazelle. And there's a lioness in each and every one of us.
Amen.
And we shouldn't stoop and try to eat grass just because we're in bad circumstances. This 2020 shall pass. And just thrive regardless. Just That's like the lion.
Thrive regardless. Find those gazelles. I love it. I love it. We will remind our viewers once again, thrive regardless. We appreciate you, Dr. Omarine. Your smile itself is enough to light up my emotional wellness for the rest of the day. and I feel like I've learned a lot from you as a fellow physician, as a fellow Black woman. I appreciate you, and I hope that you'll join us again as a guest. Thank you so much for coming.
Absolutely. Thank you so much. Thank you so much. And very nice meeting both of you.
Nice meeting you.
Nice meeting you too. I love that. Thrive regardless. We've heard so many wonderful things from our experts. And the last thing I want to do, because this is our debut for this series, and that's why it's a bit longer, because we wanted to bring on our experts. We wanted to share with you a lot of information, and we wanted to let you know, prime you to the fact that you'll be getting tidbits like this, including some of the full interviews with some of the guests that you saw earlier throughout the next 2 months. But I wanted to bring on our crew, our full crew. Now, 2 of our crew is just joining us now. They're actually on the front lines at work. And the question we have for them and for everyone out there is, are we okay? Are we okay? Are you okay, Morgan?
I make it, yes, I'm okay. Thank God. But a lot of us aren't. A lot of my family members aren't. And watching a lot of it, first of all, I want to say I'm sorry I wasn't there. It was an amazing show, amazing experts and a lot of good advice. But I do recognize in the Black community that it is hard for us to ask for help. It's hard for us to seek help, and a lot of us don't know when we need help. But I encourage you, like Lola said, I encourage you to realize that when you do have a problem, to go out there and get help. I too realized that I needed help because I was dealing with a lot of other people's problems. I had to learn how to face and deal with my own. So I will too, like Dr. Omarine say, I did seek help for myself, and it's okay.
It's okay.
And I encourage everyone else to do that as well.
Absolutely. How about you, Dr. Yuli? Thanks for joining us. I know you're just coming back from a shift. Are you okay? Yolanda, can you hear me?
Can you hear us?
I cannot hear you guys.
She's not okay. At least her audio is not okay.
Can you guys hear me?
We can hear you very well. Okay. I'm not sure why you can hear us. Are you still in the hospital or are you at home?
I can't hear you guys. I'll make it quick. If the question was, am I okay? I'm getting there. I found out that a patient I had passed from COVID mid-March. And I remember being at home, finding out and hitting my kitchen counter so hard that I broke my wedding ring. And it had nothing to do with me getting infected. It had everything to do with the child that I was breastfeeding getting infected, or my mother-in-law getting infected. And that just started a spiral of anxiety that I'm still trying to get a hold of. But I see a therapist. Shamelessly, I see a therapist, and I encourage everybody else to do the same if you need it.
Absolutely. I almost feel like all of us should. I feel like there are certain professions. I know law enforcement. I have some friends in law enforcement who say that sometimes they're mandated to see a therapist. And so I almost wonder why in our profession we're not. I think if it's normalized, if everyone has to, it's not even if you feel like it, if everyone kind of has to on some level, get therapy or take initiative when it comes to their mental health, it won't even be a thing because everyone's doing it. Everyone's doing it. Sonia, talk to me. Are you okay?
I am kind of it some days I'm not. This 2020 has been very, it's been quite a lot, as we've said, I guess, as being repetitive, but more so with COVID, working, seeing people sick, taking care of them, but then also worried about ourselves, bringing stuff to our family members, also having enough PPE, also having the things that we need, worrying about that.
Right. That's personal protective equipment, right? To protect ourselves in the hospital. Yeah.
But then on top of that, you come home, you turn on the news, somebody who was minding their own business, was accused of something because they looked a certain way, got killed by the police.
Right.
Found out they were innocent. They weren't doing anything. Even if they weren't innocent, they shouldn't be killed, regardless, innocence or not. And then on top of that, politically, how people are dealing with it. Then you look at the news. Yes, the trifecta. You
The trifecta. Yeah.
you look at the news, and depending upon how they want to spin things. And then I had this horrible thing where I was looking at Facebook. So I would look at all the comments, all the horrible comments that people were making based upon whatever post that they didn't like, this political party, that. And I'm just sitting there like, how horrible. I'm living in this world with people like this. So I really had to limit myself, cut it off. And not to say I don't want to be aware of what's going on, but I have to be kind to myself and take care of myself, because otherwise I can't take care of other people.
That's right.
So I go to a therapist because, my pastor, I go to Elizabeth Baptist Church in Atlanta. And so he said, hey, how do you think I can take care of all of you if I don't take care of myself? I have to talk to somebody. If y'all talk to me and I'm taking all this on, I have to take care of me. And so that resonated with me, and so I go to talk to someone. And the other thing is I use the Calm app. That app.
Use the what? Oh, the Calm app?
Calm app. Yes, I
Okay.
use that. It's awesome because I was having such anxiety, like I look at the news and that kind of stuff, and then trying to go to sleep at night. I couldn't. So the Calm app actually has all these great, like you just listen to the rainfall or like babbling brook. And I know it sounds simple, but it's just a way to you listen to that, relax, not worry about all those things that are going on, and help you to go to sleep. And that's what I've been using. And that's what I've been doing.
I love it. I love that advice. Maybe I should try it. I've never tried it. Dr. Yipe Welch, my sister, just brought it up. So I'm happy that you're kind of endorsing it too. Davida, are you okay?
I am doing the best that I can right now. Mainly what Dr. Penson was talking about, I experience that all the time. That's exactly what my life is right now. All these different things are influencing me to either be sad or anxious about a lot. I did a lot of travel nursing this year, and a lot of the facilities that I went to, like I was saying earlier in the interview with Dr. Omarine, the way that I'm seeing people die definitely has started affecting me. And I too see a therapist. So I definitely think that it's something that has helped me cope. I encourage others to do the same. And we just have, like you said, thrive regardless.
Absolutely. I like that. I'm okay. Some days better than others. I definitely feel what you all are saying. We are in the ER and we're seeing people come in, like you've mentioned before, and others who are dying in ways we have never seen. There's a lot of uncertainty, and we're people in the end. And I think, a lot of people talk about doctors and healthcare professionals having kind of a God complex. And that can be true of some people. It can, where they feel like, well, I should be able to do it and so forth. Those of us who have been doing it long enough really know that God is really in charge, not us. But nonetheless, I think this year has humbled a lot of the medical and scientific community, because we're just seeing things from the eyes of lay people when it comes to COVID-19. There's anxiety about bringing things home that I have had. I have, woke up in the middle of the night and been like, my nose is kind of stuffy. Do I have COVID? Like I've been freaking out about stuff, and I'm not a panicky person like that, not about stuff like that. But it's not just about me. It's about my family and not wanting to get my children sick, my husband sick, my mother. I haven't seen her in months. The last time I saw her was only because of a funeral of a cousin of mine who's died. There's a lot of death. There's a lot of fear. And I think that we need to really tap into that, recognize it, and respect it, and understand that it doesn't make us weak. It doesn't make us too scared, or what do they call scaredy cats or so forth. There's a lot of political rhetoric talking about people who are scared of the coronavirus and how they shouldn't be scared and live your lives in fear. It's not that you're living your life in fear. You're living your life in recognition that there is something serious there. And fear is okay sometimes. And it doesn't mean that you don't have faith. Sonia, you were talking about faith in our communities and how some people don't want to seek help. I'm so happy to hear that there's a lot of faith leaders who are seeking mental health, because they're not mutually exclusive. You can believe in God, as I very much do, and still need help, need that edification from the people that he's put here on earth to help us out, which may be mental health specialists. So I think we're hanging in there. we've heard from our experts all the reasons why it's difficult to do so this year. I think we need to keep on holding on to each other, even if it's through Zoom, even if it's through your social media. But we have to be careful what we put in ourselves too. In an interview that you all will see later when we release it later in the month, you'll see some of our experts are saying you got to turn it off sometimes. All this social media, all the news and so forth, although it's important to know what's going on, you can't have constant barrage of images that are just tearing you down. And so I think we're okay. Some of us less than others, but we can be better. I want to just show you all some of the things that you all have told us through your survey about how you're feeling in 2020. We asked you all, do you often feel anxious? And the vast majority of you, I shouldn't say the vast majority, I'd say a good majority of you, almost 60% said yes. We asked you all, do you feel more anxious often this year than in prior years? And 62% of you said absolutely yes. We asked you if you've experienced more death or loss this year than usual. Many of you have talked about how there's so much death and we're seeing dying in ways we've never seen before. And interestingly enough, not that many people felt like they were having more death or loss this year, but yet people still felt anxious. And then we asked them if they felt more sad. Do you feel sad more often this year than in prior years? And you can see that most people say yes, they do feel more sad. What about sleeping? Because a lot of you have mentioned problems with sleep. And so we wanted to know from our viewers and our surveyed audience, are they having difficulty sleeping? Are you having difficulty sleeping? And you can see that most people are. And we also wanted to know if it was more this year than other years. And I'd say it's about 50-50. Some people said, yes, this year it's harder for me to sleep. Other people said, no, it's not. So we wanted to know, what about hope? So along with depression and anxiety, there's always this sense of, is there hope? And so we wanted to know, have you been feeling a loss of hope in 2020? And as you can see, about 50-something% said yes, 55% roughly. And what about the whole light at the end of the tunnel that we talked about in one of our interviews? Do you believe that things will get better or worse in 2020? And what struck me here is that a large majority have no idea. They just don't know. We just don't know where things are going to go. And that's what our surveyed audience said as well. We asked about financial setbacks or losses. And for the most part, people said no. I mean, 52% said no. But then when we wanted to ask specifically about the different things that we've heard mentioned throughout the broadcast as potential sources of stress in 2020, we asked, is COVID-19 a source of anxiety or sadness for you? 73% of all people surveyed said yes. We asked specifically if the economy or finances were a source of anxiety or sadness, and 60% said yes. We asked about the highly publicized recent shootings of Black people. Is that a source of anxiety or sadness for you? You can see that 91% of the people surveyed said yes. We asked about the current racial climate and whether it's a source of anxiety or sadness. Once again, 93% said yes. And of course, we had to ask about that election that is upcoming. Is that a source of anxiety or sadness specifically? 80% said yes. I don't think that surprises any of you.
No.
Some of the things that are on your minds too?
Yes, definitely.
Pretty much. Well, we asked people to also text in what it is that's the biggest source of anxiety or sadness for them this year. One person said unemployment. Another person said the impact this pandemic has had on my children. Another one talked about the widening divide along racial and class lines. Still yet again, somebody mentioned the suicide of his or her son. You know, it's an anonymous survey, so I don't know the gender of the person. The election probably came up in 50% of the respondents said something about the election, some way, shape, or form. So this is obviously causing a lot of anxiety in people in this society. And then somebody mentioned being a frontline nurse in the pandemic as a source of stress, which our nurses here, Morgan and Davida, have told us that's definitely a source of stress. I can tell you as a physician on the front line, and Sonia and Dr. Yuli, you've also mentioned, those are all things that we also share with our surveyed audience. So that's what's bothering people. That's what's on our minds. We're maybe not okay, but I think we're going to be okay.
Yes.
What are your final thoughts as we say goodnight?
I can say that I've yet to see the light at the end of the tunnel, but I'm a believer and I have faith that we will. But most importantly, seek help if you need it. That's the only way you're going to stay afloat. That's the only way you're going to stay healthy enough for your family. And for for all of us, that's the only way we're going to stay healthy enough for our patients.
Great.
Yes.
Last thoughts, Sonia?
No, I totally agree. You know, I know everybody's like, all of a sudden 2021 is going to come and everything's going to turn off, you know, but I don't know if that's necessarily true. I think that's just it from the standpoint of figuring out the strategies you need to do to take care of yourself. And I think the best thing that I heard tonight was grace. Having grace with others, but having grace with yourself.
Yes.
And recognizing whatever you need to do to take care of yourself and doing that.
Amen. I love that. I love that.
Yeah.
Grace.
Yeah. So that's what I'm going to try to do moving forward. And also, everybody, we all need to be there for one another.
Yeah.
You know, not isolating ourselves, making sure if we think somebody's isolating themselves, reach out, making sure, checking on people to make sure that they're okay.
That is absolutely true.
Absolutely.
Yolanda?
I think that all of the negative feelings that we've got going on are all valid. I think it's okay to recognize that they are. And I want to say, I think that recent events have ruined the word stand for me. So I'm going to say up.
You don't like the word stand, like stand by or anything like that?
Yeah.
Those words don't make you proud?
Not right now.
There'll be something else. But I say stand strong and stand up.
I love that.
Mm-hmm.
I love it. Stand strong and stand up. Davida, what do you have for our viewers in conclusion?
I would definitely say that there's no right way to deal with this and with everything that's going on. This has never happened before. We just have to stay motivated to keep going. You know, I know it seems with everything going on, it's despairing a lot of the time. But like Dr. Pence mentioned, we do have to give ourselves grace and check in with people. I know that it's easy to get distracted with everything that's going on, but just taking the time to really focus in on what's important to you, your loved ones. That's it. Because at the end of the day, that's all you're going to have.
That's right.
Yes.
I want to say, I think we're going to be okay. You may not be okay right now, but you're going to be okay. As long as we recognize that it's important to take care of all aspects of ourselves. So we're focusing on mental health today, right? But we need to make sure that we take care of our physical health as best as possible. Sometimes we feel shut in, especially with all the restrictions, many of them lifted in most states, but get outside, take a walk. Your emotional well-being is important. Your spiritual well-being, especially if you're a spiritual person, check in on that too. Just looking at ourselves as a whole and not just different compartments. That's one thing. And two, recognizing that there may be subtle things that you're missing. Okay. That's personally, that's with your loved ones. That's as physicians, healthcare workers. You may be picking up on something the wrong way. So speaking to our experts, we've heard how sometimes a child who's throwing more temper tantrums might be really suffering because of all that's going on with virtual learning and isolation. That relationship that you have that's struggling with your spouse, with your siblings, with your parents, it might be because of how you're feeling. So it kind of goes with the picture of grace. Don't assume that because somebody is behaving a certain way, that it's something personal. Right. And that goes with the patients that I see too. I saw a patient who came into the emergency setting 3 times for the same thing. And it wasn't, I saw her 2 of those times. But it wasn't until the third time that I sat down and I learned that she had lost 3 family members from COVID-19. And that's why even at 21 years old, she was terrified when she was feeling what she complained of as chest pain. So I have chest pains. I have chest pain. She had every kind of workup you could imagine, even those that you wouldn't necessarily do on somebody with no risk factors for anything major. But it wasn't until I found out, this person is suffering. And she broke down and cried. She's like, I'm scared to fall asleep at night. I know I don't have COVID. And she was tested every time she came in. You better believe she was. But even though I don't have COVID, I'm scared I might not wake up. And she talked about how she wants to stay in bed with her mother as a grown woman. And she feels ashamed of that because she just wants her mother to watch her and make sure that she wakes up. And she has no mental health history. And I know that there were some people who were a little bit annoyed to see her 3 times coming into the department. What is she coming for? She's young and healthy. Maybe that's what she's coming for. So all that meets the eyes isn't all what it really is.
Right.
Let's have the grace, the patience, and compassion to discover that. We'll see you all over the course of October and November in our Are We Okay series. Thank you for hanging in there and joining us. For all of our experts and our after talk, stay well, thrive regardless. We'll see you next time.